Hi everybody, Dr. Joe Brown. Wanted to answer some questions regarding high blood pressure, cholesterol specifically. So I've had quite a few emails from mostly the older generation, from the 50, 60, kind of 70, kind of older population. And they said that essentially they've been going to their doctor years and years and years, their conventional medical doctor, conventional DO, and their blood pressure's gone up over the years, and they've been put on different medications, from high blood pressure medications to diuretics, things to help lower those blood pressure problems that they're having. And so what's happening, and I've seen this for years and years and years, is that people go into their conventional medical doctor, they have some side effect or some illness or some condition going on, their doctor sees them for all of 2 minutes, they write them another prescription, and send them out the door and say, I'll follow up with you in around 6 months or so. And so when it comes specifically to high blood pressure, high cholesterol, bad cholesterol levels, things of that nature, what can you do to get those down? If you continue to take blood pressure medication, it's going to bring your blood pressure down to a certain point. The problem is that they're not addressing what's the cause of your blood pressure being elevated or your cholesterol being elevated. 9 times out of 10, the people who have high blood pressure or high cholesterol, it's typically people who are not exercising, they're not eating correctly, they're taking in too much sodium or salt in their diet, they're drinking too much caffeine, they're drinking coffee every morning, things of that nature. So one of the things that I want to do is just kind of briefly talk about what are things from a dietary standpoint you can do to lower blood pressure. So like I just mentioned, you definitely want to get rid of all salt in your diet, okay? That means table salt, deionized salt, sea salt, salt on labels, any kind of salt of any kind, because salt is going to elevate your blood pressure, okay? Now, what happens is it's also going to cause you to retain fluids in your system. So if you tend to get edema in the legs or swelling of the ankles or swelling around the pelvic or abdominal region, again, you're going to want to cut out your sodium, okay? The other thing that you're going to want to do is you're going to want to get rid of caffeine in your diet, okay? Especially coffee or black teas of any kind, because caffeine will elevate your blood pressure as well. Now, typically what happens here is that when people go into their conventional doctor, they usually put them on a blood pressure medication, or if they have high cholesterol, they're going to put them on a statin drug, okay? You've probably heard of many of these different statin drugs or blood pressure medications on the TV commercials. Now, what's the problem with statin drugs? The problem is that if you have high cholesterol and your doctor puts you on a statin drug, well, why are they doing that? They want to bring down your cholesterol because they're afraid that you're going to have a heart attack because you have high cholesterol levels. So when they put you on a statin drug, they say, well, let's watch it over the next couple of months and we'll see your cholesterol levels down the road here. There's been numerous studies that have been out that show statin drugs only lower your cholesterol 10 to 15% at the most. Okay, and these are conventional medical studies, not naturopathic studies. Now, when they put you on these cholesterol-lowering drugs like statins, for example, because they want to protect your heart from the cholesterol so you don't have a heart attack, 9 times out of 10 or 10 times out of 10, the doctor is telling you to take the statin drug, but he's not telling you to take Coenzyme Q10. And what they're not telling you is that statin drugs, the more statin drugs you take, the more Coenzyme Q10, which is a naturally occurring protective heart substance in your body, that will also decrease in your system, okay? So in other words, the more statin drugs you take, the more Coenzyme Q10 you're going to decrease in your body. Coenzyme Q10 is one of those main protective things that you have in your body, okay? It's essentially like a key vitamin or a key mineral in your body that protects your heart and protects you from having a heart attack, having a stroke, increasing oxygen in your body, things of that nature. So if you're going to be on a statin drug, you have to take Coenzyme Q10, because otherwise you're actually causing yourself to be more prone to have a heart attack or a stroke, because your Coenzyme Q10 levels have went down, okay? So when people are emailing me and they're saying, well, how do I get off of these drugs? How do I get off of these statins and these high blood pressure medications? Well, number one, you never want to do that very quickly or just stop, because you can actually cause yourself a problem. But if you're going to try to lower that, you always want to work with your doctor, obviously, or work with myself. I can help you do that. You want to make sure that you are getting on a good exercise routine, getting rid of sodium in your diet, getting rid of sugar in your diet, getting rid of the coffee or caffeines in your diet. Now, a product that we've designed, it's actually called blood pressure cholesterol, okay? And I'll just bring this forward here so that you can take a look at this a little bit. What this is blood pressure cholesterol. This is a product that we formulated. It's got a host of different vitamins, minerals, herbs in it, things like Coenzyme Q10, which we just talked about. It's got hawthorn in it. It has garlic in it. It has magnesium in it. Okay, it's got a number of different things in it that are all combined, all in one product, so you don't have to go out and buy 8 different products for your heart or to lower your cholesterol levels. And what we do is we use this product along with a couple others, along with a good diet routine and exercise routine, to help lower those cholesterol levels, lower those blood pressure levels, so that we can get you healthy and get you off of those medications. So again, I can answer more specific questions if you have more. Again, you have our website, drjoebrown.com. Thanks for watching the YouTube videos. Click subscribe, and you'll be getting our daily videos that we're putting out, answering everyone's questions as we go here. So again, I hope that helped you. I hope that answered your questions. Thanks, guys, and have a great weekend, okay? Bye-bye.